A second American aid worker diagnosed with the Ebola virus is back in the United States. Nancy Wrightbull arrived at Emory University Hospital in Atlanta Tuesday afternoon after being flown into the country on a specially equipped jet. She's now in a special isolation unit and is said to be in serious but stable condition. Meantime, her colleague, Dr. Kent Brantley, is also being treated at that hospital. They both got infected while working at a missionary clinic in Liberia. Their treatment includes an experimental serum. The World Health Organization reports the death toll from the Ebola outbreak in West Africa is approaching 900 people, with more than 1,600 cases overall. And for more on this, I'm joined on the phone by Tariq Yasrevich of the World Health Organization.
Hello, thank you for having me in your program.
Thank you and welcome to our broadcast. First off, let me ask you, tell us why this is considered an outbreak and not an epidemic.
Well, this is a very serious situation that we are dealing with right now. It's by far the deadliest outbreak so far of Ebola, and moreover, it has been spread over a geographical area, over 3 countries, and now we have Nigeria as well, making it very difficult for health authorities and international partners to put in place all those measures that we know are needed to contain the outbreak. So this is why the WHO Director General met with presidents of affected countries this weekend, basically to put emphasis on the need to put more people and more resources and try really to contain this outbreak at its source.
I see. Mr. Yasarevich, please tell our viewers about Nancy Wrightbull and Dr. Kent Brantley, this special serum that they have been receiving. Why is it not available to everyone? Please let our viewers know this.
Well, WHO was not involved in those particular cases. I would just like to mention the one thing is that this case shows how vulnerable health workers are. From the beginning of the outbreak, we had more than 100 health workers from the 3 countries being infected, and 60 of them died. Now, when it comes to the particular case of these 2 doctors and the treatment they have received, WHO really thinks that all drugs should go through a necessarily safety trials and procedures and be regulated and be licensed. Now, there is something called as a compassionate use, meaning that if there is an experimental drug being available, this can be used with the informed consent of the patient. However, this is something really that should be looked more carefully on, and we should really try to get whatever research is being done, try to really go through the necessary procedures.
Is there any guarantee that the healthcare workers at Emory Hospital in Atlanta will also be, will they be safe? Will they be infected?
Well, let's go back really to the places where this outbreak is happening right now. So as I said, more than 100 health workers have been infected, 60 of them have died. This really shows that health workers have to be trained, have to be equipped properly, and we need to have enough of health workers so they do reasonable shifts, so they can take care not only of the patients, but also about themselves. So Ebola is something that can be prevented if we follow infection prevention and control measures, if population in general, not only health workers, follow the advices of the health authorities.
Tariq Yasarevich with the World Health Organization, thank you so much for joining our broadcast.